and welcome to Politics in the Pub. I'm Chandran. The topic for today is titled Drug and Alcohol Law Reform, About Time. Now, as we all know, the demand and supply of illicit drugs in Australia has only gone up in the last half century, despite tougher enforcement laws and stricter implementations. Now, you might ask why this is so. Now, I'm just thinking loud. Could it be because illicit drug use is actually a social problem and we have not realized this? Now, countries in Europe like Switzerland and Holland, they seem to have realized this and they have reformed their drug laws accordingly. Perhaps as a result of this, the problematic drug use in those countries have come down. So is there something that we can learn from those nations and their experiences? Now, to address all such issues and tell us more about the topic, we have two wonderful speakers with us. They are Dr. Alex Wodak and Mr. or should I say Professor Nicholas Cowdery. Alex will be speaking first, so I'll quickly introduce Alex and then I'll introduce Nicholas Cowdery just before commencement of his talk. Now, Dr. Wodak is currently president of the Australian Drug Law Reform Foundation, and he was previously the president of International Harm Reduction Association. That was from 1996 till 2004. Now, he helped establish the first needle syringe program and the first medically supervised injecting center in Australia, when both were pre-legal, and often works in developing countries on HIV control among injecting drug users. Now, Wodak also helped establish the National Drug and Alcohol Research Center, the NSW Users AIDS Association, and the Australian Society of HIV Medicine. Now, he's also an emeritus consultant, alcohol and drug service at St. Vincent's Hospital, Sydney. Ladies and gentlemen, please welcome Alex Wodak to Politics in the Pub.
Well, good evening, ladies and gentlemen, and thank you for the invitation to speak here today, and thank you all for coming along here today, and my apologies for arriving late. I was besieged by the press. There's been a development in Victoria today, which is very relevant to what we'll be talking about today. 3-year-old child with epilepsy that can't be controlled by conventional means. The parents have 4 other children. The mother is 35 weeks pregnant, and the parents, in their desperation, turned to medicinal cannabis, been giving their child small quantities of medicinal cannabis. They claim it's controlled their son or daughter's epilepsy. And today, the family's home was raided by the police. The tincture of cannabis was seized by the police. The parents were ordered to appear for interview at a police station. The police made it clear that they were very uncomfortable carrying out what apparently were their orders. So you read all about this in the newspapers tomorrow, see it on television tonight, and I was asked about that. So this is something that is being done in our names, and that's what we're going to talk about tonight. And of course there's a whole history to this. We don't just suddenly arrive at these events on July the 10th, 2014. There's a long lead up to this. Now, the whole drug prohibition policy was gradually introduced over a period of decades, began in the early 20th century and probably reached its high mark in 1988 with the third of the three international drug treaties. Australia signed the three of them, and in the last decade or two, it's this international arrangement has been getting under increasing scrutiny, increasing criticism, for reasons like the reason I just gave you now, the example I just gave you now. And what I want to start off doing is telling you a little bit about what's happening in drug law reform around the world. Drug law reform really began among governments in the 20th century in Europe. And the Netherlands was really the first country to deviate from the universal international system that applied, which relied very heavily on law enforcement and just tokenistically flung a few coins in the direction of health and social interventions. And the Dutch in the 1970s, after a crisis, decided that that wasn't working for them, and they had two commissions carried out by a sociologist called Bahn, and they decided to adopt a different approach, and out of that came a much more health-focused social approach. They started to allow cannabis to be sold from the so-called coffee shops. Crazy system where cannabis was still illegal to cultivate and produce cannabis, but it was legal for these coffee houses to sell it. And they made other arrangements that were beneficial to drug users and their families, treating them much more compassionately. Switzerland followed a similar route in the 1990s. In Switzerland, there was a real sense of crisis. Things were falling apart. The breakdown of the Soviet Union and of the Yugoslav Federation had a lot to do with that, and a lot of high-quality criminals made their way from the former Soviet Union and Yugoslavia to come to the richest country in Europe to ply their trade. They got into the drug business. Drug business expanded, and life for many Swiss citizens became very difficult. Drug overdose deaths went through the roof. HIV infection among people who inject drugs was completely out of control, and women weren't able to walk anywhere near a railway station anywhere in Switzerland because they'd get their handbags snatched. Life was intolerable. The authorities in Switzerland turned to the people they normally turn to for advice and said, what should we do? And the advice they were given is, get tough. Give more money to the police and law enforcement authorities, pass harsher sentences. So they did that, things got worse. So they went back to their advisors, what should we do? Do it again. So more severe penalties, expand the drug squad, things got even worse. They did this a few times. Then they realised that that was clearly not the approach needed. So then they decided to approach different advisors. They didn't ask me, but they asked friends of mine around the world, and they said to them, treat it as a health and social problem, based policy on evidence. And that's what the Swiss governments did. And the results were terrific. Drug overdose deaths fell, HIV came under control, crime fell, and people were a lot happier. And the president at that time was Dr. Ruth Dreyfus, President Ruth Dreyfus, and she was very impressed by this whole experience, and she's become one of the leaders in this international drug law reform movement that's now evolved around the world. And after Switzerland, the next European country of interest was Portugal. Portugal had a very similar problem, sense of crisis, and Portugal started a debate that occurred within the parliament, outside the parliament, in the community, politicians in the community engaging a lot. And they commissioned a plan by their most celebrated doctor working in the drug and alcohol movement, Dr. Joao Goulart, and he chaired a committee, and he came up with a plan And the Parliament and the community debated this plan, and they decided to adopt the plan in toto. No changes were made to it. And that was adopted and came into effect on July the 1st, 2001. And again, as in Switzerland, drug overdose deaths fell, HIV infection came under control, crime fell. Very familiar pattern. And the Portuguese are very happy with these results, and they're happy across the political spectrum. Of course, there are some opponents, there are opponents to everything, but it doesn't seem likely that this system is going to be changed at all. When Portugal has been going through severe economic financial pressure during the last 5 years or so, since the global financial crisis, one thing they didn't really seriously touch was the system they established for dealing with illicit drugs. And what happens today, if you get caught with illicit drugs in Portugal, is that you are referred to a panel, provided the quantity of drugs you were seized is considered to be consistent with personal use only. So they have got a quantity of for every conceivable type of illicit drug, and if you're below that quantity, you go through this referral system, otherwise you go through the standard legal system. And when you go through the referral system, you get referred to the Committee of Drug, sort of the Council of Drug Dissuasion. And you come before 3 people, typically a social worker, psychologist, a lawyer, that sort of thing. And they ask you about your responsibilities, how you're functioning. Are you looking after your aging parents? Are you looking after your children? Are you looking after your husband, wife, boyfriend, girlfriend? Are you keeping up the payments on the car? Are you paying the rent on your flat? These sorts of things. And they check up on all of these things, and they have carrots and sticks, and if you decide not to cooperate with the system, they can make life difficult for you. System is very well supported, and I went to that building where they do this in Lisbon and talked to the staff there about it. It's very popular. A lot of people from different countries in Europe now come and visit Portugal to check this out. So that's what's happened in Europe, and there's a sense in the rest of Europe that the rest of Europe is marching towards the system that I've just outlined in those 3 countries. Now the system, the international attention has turned to the Americas, and it's turned to the Americas because the United States uses about half the illicit drugs used in the whole world. Huge demand, and you could ask why Americans would want to use such a large proportion of the world's illicit drugs, but they do. And the Americans managed to stop a lot of the drug trafficking that was going on over the seas. And therefore the drugs travelled from south to north through South and Central America. Now that's travelling overland, not travelling over the seas anymore. So that includes cannabis, heroin and cocaine. Other drugs as well, but principally those. As you know, Central America gets quite narrow. And in the narrow parts of Central America, Honduras, Guatemala, there's a lot of fights over territory. Levels of violence are unbelievably high. Huge, very high homicide rates. And the homicide rates have also increased significantly in Mexico. The Mexican president, assuming office on the 1st of December 2006, on his first day in office, declared a war on drugs. And the homicide rate over the next 4 years tripled, from 8 per 100,000 per year to 23 per 100,000 per year. I'll say that again, 8 per 100,000 per year to 23 per 100,000 per year in 4 years. Now, our homicide rate's about 1 per 100,000 per year, so it went from 8 times our rate to 23 times our rate. Mexicans have got it easy. Just think of the people in Honduras and Guatemala. They have homicide rates of over 100 per year. And Colombia reached its peak in 1993 when their war on drugs was being fought most bitterly. And the national figure for Colombia in 1993, 70 homicides per 100,000 per year, 70 times our homicide rate. But think of the good citizens of Medellin, Colombia's second biggest city, 420 per 100,000 per year. It's hard to believe what life would be like, except imagining that it's some kind of a war zone. So the South Americans are very concerned about the effect of America's war on drugs on their people. And the result of that was that in 2012, they had a summit of the Americas where the 35 or so countries of North, Central and South America gathered together at the meeting they have every 2 years of the presidents. And despite the strident opposition of two countries, the United States and Canada, all the other countries in that organisation wanted drugs to be on the agenda. And the 33 countries won, and the two countries, the United States and Canada, lost. So drugs was on the agenda and was discussed. And the upshot of that was that they decided to refer the matter to another organisation, the Organisation of American States, the OAS, for a report about what South and Central America should do about the problem. And the report was released last May 2013, and it was the first time any multinational organisation had said, one of the things you might want to think about is legalizing drugs. Never been said before by a multinational organisation. So you get a sense in Australia that this is impossible to move, but things are moving. Now, I'm sure everyone here knows that two states in the United States, Columbia and Washington State, voted 55 to 45 on a ballot initiative, separate ballot initiatives, to tax and regulate cannabis. And that started in Colombia on the 1st of January this year, and that's in Colorado, thank you, and it started in Washington State just today. So this is a new history. It's never happened before. And then we had Uruguay last year, both houses of their legislature voting in favor of legalizing cannabis. And that's due to start in about 6 months' time. Hasn't started yet. And last July we had, on July the 11th in New Zealand, we had the unicameral House of Parliament there voting 119 to 1 on the new psychoactive substances bill. And what that involves is that New Zealand, more so than, so they claim, any other country in the world, New Zealand has been inundated with these new synthetic drugs. These are drugs that people invent on the weekend after the Parliament has banned a particular drug on a Friday. They'll invent a new drug, and by Monday morning they've got it up and running. And so we're inventing about one of these new drugs per day somewhere around the world. Almost 365 were invented last year. So this is another indication of the colossal failure of drug prohibition. So New Zealand decided, under a national party that is a conservative government, they decided to do something about that. And the bill was voted on, passed on July the 11th. And you might want to look up the third reading speech of the Associate Minister for Health in introducing this bill, because he says in his first paragraph, he says, this bill is to protect New Zealanders, especially young New Zealanders, from untested drugs in an unregulated marketplace. And that's really what this is all about, untested drugs in an unregulated marketplace. Well, the New Zealanders estimated there were about 3,000 to 4,000 places where people in New Zealand could buy these new synthetic drugs. before the bill came in, and that number went down to 40 registered places. So that was a 95% reduction in the number of outlets for these new psychoactive drugs. And they reduced the number of psychoactive drugs from an estimated 200 to 47 drugs that had been tested and considered to be of acceptable and low risk. And so those went on the marketplace, and I went to a meeting in Auckland in March this year where all of this was discussed, and a very senior policeman gave us the figures that I've just repeated to you now. These used to be on the Ministry of Health website in New Zealand. They're not there now. And then it seemed everyone thought this was a huge success. Across the political parties, you can imagine, with a 119 to 1 vote. Now New Zealand is facing elections in the next few months, and just on April the 27th this year, the New Zealand government suddenly scrapped the system overnight, and New Zealand's gone back to the previous law of the jungle. Now, it's curious why they've done that, and they've made some a claim, seems a very weak claim to me, that they're doing this for good policy reasons, but it seems fairly clear to most New Zealanders that the real reason New Zealand is doing this is for political reasons, because the national government, National Party feels they've got a better chance of getting re-elected if they go tough on drugs, and then after the elections presumably they'll bring the bill back again. There were some faults with the bill that have been discussed publicly in New Zealand, and they're things that they've said that they would rather do if they had another chance at it. Since New Zealand, we've also seen Jamaica has decriminalised the use of cannabis, so no criminal penalties for its use under certain circumstances. And one of the categories that they allow cannabis use in Jamaica now is for people who are using the drug for spiritual purposes. So the old system is breaking down, and this is all going to come to some kind of a head in 2016 at the United Nations General Assembly Special Session on Drugs. That meeting was to have taken place in 2019, but because of this sense of crisis, the meeting has been brought forward by 3 years, because it's clear that things aren't working. So that's an international picture, a very quick and sketchy one at that, but it gives you some idea that you don't get from here in Australia, that change is possible and change is happening in other parts of the world, particularly in these days, particularly in the Americas, in North and Central and South America. Not so much in Europe at the moment. Europe has been preoccupied by their financial crises. But here in Australia, of course, the big issue has been medicinal cannabis. That's in recent times. And I think this debate was sparked by a 24-year-old boy, Daniel Haslam, in Tamworth. Many of you have heard about this case, maybe all of you. Poor guy was found to have terminal bowel cancer 4 years ago when he was aged only 20. Mum's a retired nurse, Dad is a retired policeman and used to be involved in the drug squad. And like many other people with this condition, he had chemotherapy, and unfortunately he got intractable nausea and vomiting, resistant to all the conventional medicines. A lot of people gave them advice. Somebody told them, why don't you try medicinal cannabis? So they did try using cannabis medicinally. And guess what? The vomiting stopped. Daniel used to not just vomit immediately after the chemotherapy, and then for some days afterwards, he started, as many people do, vomiting in anticipation of the chemotherapy. All of that stopped. He used to have to stay in hospital for several days after each round of chemotherapy to put some weight on, because he was vomiting so much. Now he doesn't need to do that anymore. He can spend more time at home with his family. The local police chief has said that they are not going to arrest Daniel. They're not going to arrest his mother. They're not going to arrest his dad. Now, I welcome that statement by the local head of police in Tamworth, but what a terrible position we are putting the police in, where we're saying that we're requiring the police to choose when to enforce the law and when not to enforce the law. Reminds me of the case in Tasmania 20 years ago last year, where two gay men got a statutory declaration about their sexual activities the night before, and went to the local police station and tendered the document and asked the police to arrest them, because homosexuality in Tasmania used to be a criminal offence until not so long ago. And the police interviewed them, and when the police announced that they were not going to press charges, it was, I think, fairly clear that the laws of homosexuality in Tasmania had to go, and they did. Until then, the politicians had been unwilling to take that step. So congratulations to those two brave men in Tasmania, and congratulations to the Haslam family, who have done so much for their son and so much for other people in a similar position around the country. Now, the position here is that 69% of the community in 2010 supported the idea of Australia using medicinal cannabis. 20 other countries around the world already do that. 74% of Australians support the idea of research into medicinal cannabis. We do virtually no research on medicinal cannabis in Australia. And these figures come from the National Drug Strategy Household Survey, which is commissioned by the Commonwealth Department of Health every 3 years, and those data were gathered in 2010, published the next year. At that time, there wasn't really a debate about medicinal cannabis in Australia. There has been a vigorous debate for the last 12 or 18 months, and I'm sure that the next time those figures are collected, they'll be a lot higher. They're about 80% in the United States. I think you have to ask yourself, why are we in a situation where 9 out of the 9 health ministers in Australia are opposed to medicinal cannabis? The evidence is fairly convincing. There are 82 favourable randomised control trials in support of medicinal cannabis. Now, a randomised control trial is considered the most stringent test in medicine for the effectiveness or ineffectiveness of a particular intervention. You get a group of people with a particular condition, you randomly allocate some to have the experimental intervention, others to have the standard intervention. And we have 82 favourable trials like that support medicinal cannabis. We have 9 unfavourable control trials. That's pretty good evidence. There'd be many interventions in medicine that don't have that kind of evidence behind them. So we also know from trials of medicinal cannabis that medicinal cannabis is also safe, and that's important. It should be safe. We shouldn't use something that is unsafe. Now, a lot of claims are made to the contrary, that medicinal cannabis is unsafe. And these are people who are relying on studies of recreational cannabis. But it's inappropriate to base conclusions about the safety or lack of safety of medicinal cannabis by studying recreational cannabis. It's like saying that regulated alcohol is unsafe by studying bootleg liquor. If you want to see whether regulated alcohol is safe or unsafe, you study regulated alcohol. And another problem with the debate about the safety of cannabis, medicinal cannabis, is that the side effects of medicinal cannabis really have to be compared with the side effects of not giving it any medicinal cannabis, or the side effects of conventional medications that are used instead of medicinal cannabis. And some of those drugs that were used for treating, for example, chemotherapy-induced nausea and vomiting, some of those have quite significant side effects. And of course, people who have a choice of, as Dan Haslam has had, of vomiting his heart out for 3 days every time he has cancer chemotherapy, or alternatively, smoking some cannabis. Well, of course, if Daniel was our son or daughter or brother or sister or our loved one, of course we would want him to have something that works. What are we still debating about this issue for in 2014? Many other issues are arising now, and I'll finish in a couple of minutes. I want to just make a couple of observations about what else is going on here. One of the things that's going on here is that in the drug policy world, logic and rationality account for very little. What really counts is that if you're in politics, bad policy has been good politics. This is the fundamental problem, that it's easy to go out to community meetings like this, particularly where people have small children, and scare the living daylights out of everybody in the room and put your hand on your heart and say, if you elect me, the boats with drugs will stop. There have been plenty of politicians from plenty of parties who have said exactly that. And of course it's nonsense, because this is fundamentally a market. There are buyers and there are sellers. And if there's a demand for the drugs, someone is going to supply the drug. And if there's no legal source available, another source will emerge. Now, you'd be surprised at the number of people who say this these days. When he was going before his confirmation hearings in the Senate in 2001, the incoming Secretary of Defense in the United States, Donald Rumsfeld, said exactly the words I've just repeated to you. One of the senators asked him, trying to find out whether if he was confirmed as Secretary of Defense, whether the Defense Forces in the United States would intervene in the war on drugs. And so he asked Rumsfeld that question. Do you support the military, the US military, intervening in the war on drugs? And Donald Rumsfeld said, drugs are fundamentally a demand problem. And if they can't get the drugs from Colombia, they'll get it from some other country. And that applies not only in terms of the countries of origin, it also applies in terms of drug gangs, demographic groups that are involved in drug trafficking, and also it also occurs in terms of specific drugs that are used. So in other words, if people want to stop drug gang A and are successful in stopping drug gang A, they're doing a big favour to drug gangs B, C, D and E. They'll just take over that section of the market. And if they manage for some fluke to stop, say, heroin getting into Australia, some other kind of opiate will emerge. And that's been the experience, for example, in New Zealand, where heroin was stopped and people worked out how to make heroin from pharmaceutical drugs that had to be supplied to the New Zealand people. So the idea that that drug prohibition has been a comprehensive failure is now becoming increasingly widespread. And we had on the 2nd of June 2011, we had the Global Commission on Drug Policy giving a press conference at the Waldorf Astoria Hotel in New York. And we had assembled there former presidents from 4 countries, Brazil, Colombia, Mexico and Switzerland, including that Ruth Dreyfus woman from Switzerland. We had Sir Richard Branson from Virgin Airlines. We had George Shultz, former US Secretary of State, Paul Volcker, former chairman of the US Federal Reserve, a number of other notable people. And their major point was that the war on drugs has been a comprehensive failure, and it's time that we started to look at alternatives. And they went to see UN Secretary General that afternoon, Ban Ki-moon, and had the same discussion with him. And Ban Ki-moon has for several years been calling for the decriminalisation of drugs. So we have reached a point now where the debate has moved on, and I'll finish with a final quote from our Prime Minister Tony Abbott, who said when he was being interviewed by Neil Mitchell on 3AW on April the 29th, he said, "The war on drugs cannot be won, the war on drugs can be lost, but it's a fight we have to keep on fighting." Now, accept the first half. I don't see how you can go from the first part to the second part, but nevertheless, no Prime Minister, no leader of the opposition in Australia has ever conceded that the war on drugs has failed and is futile. So we've made progress to that extent. And now it's time for you, now it's time for all of us here to press our politicians, state and federal, to move on and go back to the drawing board and come back with a better plan.